Billahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. Now, my dear friends and fellows and doctors, I am actually previously taking the lectures on the infectiology, the infection and the disease. And I have reached at the urinary tract infection where the basic concepts of the urinary tract infections have been discussed. I think you should repeat or revise the video if it is possible. Then we go the second part of it is the urinary tract infection diagnosis and management. Actually, people are only interested in the diagnosis and management. But please do not behave like that. You have to go through the session 1 also if you want to become, you want to attain good knowledge, then you have to go for the session 1 also. Otherwise, just for nothing, for the sake of the management plan, you can watch this video. Now, how diagnosis have been done? Number 1, the clinical picture is very, very important. The patient is coming in front of you, and he is given the history of what he is, that is called presenting complaints, that is, and then you go with duration and history of the presenting illness, etc., past history, etc. Now, all this, what is called the history is concerned, you can have an idea that this person has been suffering from probably prolonged fever or fever with rigors or chills, intermittent type of the fever. This may be associated with the dysuria or not associated with the dysuria. Now, this gives clues in most of the cases, but no. In children, they can't speak properly. So in the children, the presentation is different. I already talked about it. There is reluctance to feed and failure to achieve the milestone properly, and those children who have got the control on the bladder now not controlling the bladder, that is the nocturnal enuresis occurs, frequency of maturation, fever. In the old ages, the different type of problem occurring, not the dysuria, not the oliguria, but rather than the infection is traveling into the blood, causing the bacteremia and then septicemia silently. So they come for the mental confusion. They come in the mental confusion and concentration, and they are unable to feed themselves, they are unable to look themselves now. The elderly people are different type of the people. So they will not tell you anything, because you have given some food, it's all right. If they haven't any food, they will not complain. How much fluids they are taking, they don't remember how much, because the short-term memory is affected in these people. They cannot express themselves. The second examination is the urine RE examination. This is very, very important examination, and I have given 1.5 hours lectures on interpretation of the routine examination, urine routine examination, how we will interpret it. The important points regarding this, one of us is the specific gravity which is increased in this case, and the frank, the pus are coming out, the color of the urine becomes turbid, and lower down you find nitrites producing organisms. Nitrites will be present. You know what are nitrite producing organisms? They are present, positive, in about 30% of cases, not in 60% of cases. They are nitrate negative. Then go for the WBC. Remember, in female, up till we take 6 WBC or pus cells per cubic millimeter, and if it is more than that, it is a normal one. It is more than that, it is definitely a significant one. In a male, 2, up to 2 will take, okay, not more than 2. The RBC are usually not present, but may be present if there is micro ulcerations because of the infection is possible. So microhematuria can occur in these conditions. An important thing afterwards are the down is the crystals. You see the crystals of oxalate or crystals of calcium. Possibility they are stones which are the predisposing factor for the urinary tract. So primary problem is that patient has a tendency to form urolithiasis. That is why he has got repeated urinary tract infection. In the same way, if you see anything like candida, etc., candida, for example, or yeast or something else, the fungi or some parasite, for example, scabies, sarcoptic scabi, in the sample of urine, it means that the person is hygienic and he may be, he caught this infection from his female or female caught this infection from the males. That is the important one. And then we go for that is the gold standard is culture. Gold standard, and in this case the minimum count is required. First of all, the count is 10⁻³ coloniform unit CFU per ml of typical urinary tract organism. If it is less than that, there is dysuria, for example 10⁻² colony forming units. It is labeled as acute urethral syndrome. It is a part of it, but acute urethral syndrome. It is not called the urinary tract infection by definition is concerned, because it should be 10⁻³ coloniform units. So, however, lower count, strong clinical picture, you can diagnose it. It is not the 100% perfect rule that 10⁻³ coloniform units are the mainstay. No. You have to go for the other one also. That is you have taken the history, you have taken the examination, everything has been done, and the clinical examination history has got the upper hand. Always remember, rather than the lab test is concerned. It will definitely define the disease, confirm the disease, but it is not 100%. It may be false positive, false negative, sensitivity, selectivity, etc. are important in the lab test interpretation. And that is why the history and clinical examination is more important than the lab tests. However, you will confirm it, which type of organism it is. Number 2, the count. Number 3, which antibiotic is sensitive to this type of organism. Now here you see here in the picture, that is, you find that the black and bean-shaped type of organisms are seen between the WBCs, white blood cells, multiple villi, and it is probably gram-negative one. These changes are indicative of urinary tract infection. Here again the same thing. They are different stain has been given here. Again here you find whether the gram-positive organism or gram-negative organism. Staining is important here. It is purple. That is, it is definitely a purple means purple. It is gram-negative organism, and if it is purple, rather pink is gram-negative and purple is gram-positive. So hematoxylin stain is using a hematoxylin staining is there. Specific stains can be used to differentiate different organisms. This is a culture plate. Here it is shown the colonies which are forming, and that is counting it out afterwards, how much colonies are there in this, how much bacterial count is there in one coloniform unit. This is a unit, this is a unit, this is a unit, this is a unit. So how much count is there of that specific organism? The pH is definitely, I've left the pH for you because it is always slightly acidic, ranges between 6 to 7.5. However, the normal range is 4.5 to 8. 8 is the maximum one. A urine pH of more than 8 6.5 or 9 is indicative of the urea splitting organisms such as Proteus, Klebsiella, Ureoplasm ureaticum, etc. Therefore, in asymptomatic patient with a high pH means UTI regardless of the other urine test results. This is how it is very important. If the urine is alkaline, and remember that is pH is more than 8.5 or more than 8, indicative of the disease, and if Proteus is associated with the stone formation, alkaline pH can signify white stone, infection stone, that is associated with mostly with the Proteus, but other organisms can cause it. Urea splitting organism can cause this. In classification, may involve the lower urinary tract, etc., and the upper urinary tract. Now, here there is a condition in which you find in routine examination that is called asymptomatic bacteriuria, without any symptom. Asymptomatic bacteriuria. If urinary tract infection involves the upper tract and the person has diabetes, pregnant, is male, immunocompromised, it is considered complicated. Comorbids is there, or condition is there, then this asymptomatic bacteria can turn out to be a symptomatic type of a problem afterwards, or a disease will be spreading inside the body as septicemia in the future. Otherwise, the woman is healthy and pre-menopausal, it is considered uncomplicated. Usually, in children, when the urinary tract infection associated with fever, it is deemed to be an upper urinary tract infection. It's mostly these children have got the upper urinary tract infection. Now, children is concerned. Now, children has got a positive urinary culture is required in this condition, but the child cannot tell you properly the history, and even very small children are not cooperative in examination also. A frequent challenge depending on the collection of the urine. Urine collection is difficult. So contamination occurs, that's why. So there are cutoff value in this condition in the children because they are not cooperative and the specimen collection is difficult. It is standard to 5 coloniform unit is used for a clean catch mid-stream sample. Difficult to collect anyway. And 10⁴ coloniform unit per ml is used for the catheter obtained specimen. Remember these very, very important points. 10⁴ in the catheter obtained specimens, and 10⁴ coloniform unit is used for the suprapubic aspiration. If it is suprapubic aspiration, then 10⁴ is significant colony count. The use of the urine bags to collect sample is discouraged. You have to go for the tubes or urinary catheter to collect the urine. And the problem is that the American Academy of Pediatrics recommends the renal ultrasound and voiding cystourethrogram. They are watching a person's urethra and urinary bladder with a real-time access while they urinate. In all children, they recommend it. It is difficult in our country actually, in less than 2 years of age, and have had a urinary tract infection. However, because there is a lack of effective treatment of problems, the NIH and the Care Excellence may recommend routine imaging in those less than 6 months old and who have unusual findings. Otherwise, then cystourethrogram, urinating or voiding cystourethrogram is not needed in every children to diagnose. Differential diagnosis. Now, in women with cervicitis or vaginitis, or associated with a young man, with a urinary tract symptom, with Schmallia trachomatis, which is a very, very important sexually transmitted disease, or Neisseria gonorrhoeae infection may be the cause. It is possible that if they are already diagnosed as a comorbid, the sexually transmitted disease. These infections are typically classified as urethritis rather than a urinary tract infection. Now, interstitial cystitis is a condition in a chronic pain in the bladder. It is a chronic pain, and the very specific findings of interstitial cystitis is concerned may be considered in people who experience multiple episodes of UTI symptoms, remember. but urine culture remain negative, 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 and not improved with antibiotics. You can consider interstitial nephritis. Another condition is prostatitis. Maybe also we consider differential diagnosis if the diagnosis is not made or diagnosis is made, but it is reflected to the therapy. Another condition which is hemorrhagic cystitis, if there is blood in the urine, possibly infections of the bladder and infection, radiotherapy, and those persons who are on the chemotherapy agent like cyclophosphamide. Another condition is eosinophilic cystitis, where the eosinophils are present, eosinophilic urea is there. Signs and symptoms are similar to the bladder infection. Another condition which causes eosinophil urea is interstitial nephritis or analgesic nephropathy, eosinophils. All other than that is the hypereosinophilic syndrome also can cause eosinophil urea. Its cause definite eosinophilic cystitis is not known, but may be linked to the food allergies or infections or medication among others. The mainstay of the treatment, antibiotics, as you know, you have to give the antibiotics. At one time, the phenoxyperidine, it is the urinary antiseptic, is originally described in Pakistan. We are practicing this drug between 1970 to 1980, 85. You can use in the first few days, although it is not usually prescribed nowadays. But phenoxyperidine was very effective at one time. It will eliminate the symptomatology like burning and urgency. Specifically for burning and urgency, the phenoxyperidine can be used nowadays also. It is not usually a routine drug. However, safety is actually risk because it can cause methemoglobinemia, higher than normal level of the methaglobin in the blood, and paracetamol may be used for the fever. There is no good evidence that the use of the cranberry products for treating the current infection. Cranberry products can only be used in the prophylaxis of the urinary tract infections. Phosphomycin, that is a very good drug, can be used as effective treatment for both the UTI and complicated UTIs, including acute pyelonephritis, which is upper urinary tract infection. The standard regime for the complicated UTI is an oral 3-gram dose, once every 48 to 72 hours, twice a week, you can say, a total dose of 3 doses, or a 6 gram every 8 hours to 7 days or 14 days when phosphomycin is given intravenous form. Full dosage. In our country, we can use the phosphomycin capsule, which is available in 500 milligram. You can give 8 hourly, patient can tolerate it, definitely, for 7 days. Or you can give the sachet, if it is severe infection, give it in alternate days. If it is not very severe infection, then you can give 1 sachet, can be given every 3rd day. If you are doing for the prophylaxis, you give the phosphomycin sachet, 3-gram sachet in 1 week to total of 4 to 6 weeks. It is a prophylaxis of phosphomycin. Phosphomycin is a magic drug. Uncomplicated infection can be diagnosed. Uncomplicated. Antibiotics taken by the mouth, such as what is called as the Septron, cotrimoxazole, nitrofurantoin, phosphomycin, are typically first line. In different countries, they are using this drug is very important, and Septron is concerned, or cotrimoxazole. Then comes the cephalosporins, the augmentin, that is amoxicillin with clavonic acid, or fluorochronocones. The 2nd generation, 3rd generation can be used. However, antibiotic resistance to the fluoroquinolones among the bacteria that cause urinary tract infection has been increasing. That is why you have to cut down. FDA warning is there, always remember, use of the fluoroquinolones. When other options are available, try not to use it. As a serious side effects such as it can cause, if you're using very prolonged time, tendinitis, tendon rupture, these 2 side effects are overlooked. They are hidden side effects. For example, you have taken the fluoroquinolone, there is severe pain in the hands, and even the tendon rupture occurs very severe, and the non-functional, for example, the 3rd finger or 2nd finger, and it can cause the worsening of the myasthenia gravis, the fluoroquinolones. Remember, these are the important things to remember if you can remember. The fluoroquinolones are not recommended as a first treatment. This is very important. The first treatment is this. Second line is this. The third line may be possibility, or other antibiotics can be used. Not like the first line. The fluoroquinolones is the third line management. Remember this point. This is very important to understand. And the complicated is concerned, it's very difficult to treat usually because it can cause urosepsis and causing septicemia, septicemic shock, etc. More aggressive evolution. You give parenteral antibiotics in this condition. Selection should be proper. For example, you have to give the monobacteriums rather. They are or what is called the carbapenems. They are good drugs, parenteral drugs, in combination or without combination. It can be used intravenously. Even the chloronic acid plus amoxicillin intravenously is effective agent, very effective agent. Asymptomatic bacteriuria means that this is asymptomatic, means the patient has developed the urinary tract infection, but it is not, it is not the clinical scenario which is indicative of the urinary tract infection. Although he has, these asymptomatic bacteria usually occurs in old people, spinal cord injuries, and those are dependent on the urinary catheters. Pregnancy is an exception, and the women take 7 days of antibiotic in pregnancy if it is there. Because if it is not treated, it causes up to 30% of mother to develop the pyelonephritis, increase the risk of the low birth weight and preterm birth, in addition to septicemic shock or septicemic shock. Some also support treatment of those with diabetes mellitus and treatment before urinary tract procedures, which will likely cause of the bleeding. So the diabetes mellitus, if this is asymptomatically, you find there is bacteriuria of significant number, you have to manage. This is the rule of thumb. Otherwise, it is other people. It is you should evaluate that patient and then decide whether you have to give the antimicrobials or not. This is another terminology which is sterile pyuria. Sterile pyuria means that the person has got no WBC, no pus cells in the urine. It is not asymptomatic, it is sterile. Infective causes are viruses, fungi, atypical or fastidial organisms like Chlamydia trachomatis, Uroplasma uretricum, Pseudomonas, and Mycobacteria. They are not cultured on the normal culture plates. Non-infective causes like the systemic and localized diseases, malignant hypertension, sterile pyuria, systemic inflammatory disease can cause this, and structural and the physiological abnormalities of the GI tract, like for example stones, urolithiasis, and polycystic kidneys, and certain drug treatment like the Endemir or the Alsazaline. These drugs is usually in Pakistan by psychiatrists. Cyclophosphamide, you know about it. It is using in the autoimmune diseases and in cases of the along with the as the malignancy is concerned. The glucocorticoids and recent antibiotic treatment. If you give the recent antibiotic treatment for 3 days, if you go for the culture in the urine, it will become negative and there will be no WBC you find. Sterile pyuria means that no WBC of indicative or the culture is negative. Symptomatic or asymptomatic. It doesn't mean sterile pyuria. Sterile means sterile. If this is a urinary tract infection, it should have contained the significant of WBC and the culture should become positive. Culture are usually not positive in this condition. These are the conditions in which you find it. The sterile pyuria means that the pus cells in the urine is there of indicative of infection with negative culture. Asymptomatic bacteriuria or asymptomatic microbial is the condition in which you do not find any organism in the urine culture. It is asymptomatic. There are two terminologies which are interrelated. The pregnant women have to give, because during pregnancy the high progesterone levels elevate the risk of decreased muscle tone, and that is the likelihood of leading to the reflux. The vesico-uterine reflux become more active, and that is why in 25 to 40% cases there is risk of kidney infection. If it occurs, then it will become a blown infection. That is why you have to give these ladies the cefalexin or nitrofurantoin, typically because they are generally considered safe in pregnancy. Nitrofurantoin in female is safe. Cefalexin is safe. Or cefuroxime is safe. A kidney infection during pregnancy may result in the preterm birth of preeclampsia and hypertension associated with the pregnancy, and the kidney dysfunction during pregnancy that can lead to seizures also. It means the eclampsia. Some women have UTIs that keep coming back in pregnancy. There is sufficient research on how to best treat these recurrent infections. Pyelonephritis is treated with a more aggressive therapy than the usual therapy. Intravenous antibiotics are likely to be given. Oral antibiotics in the high dose or intravenous antibiotics are the choice. Ciprofloxacin is typically used in the areas where there is very least resistance. Otherwise, you have to give the other one, the ceftriaxone, should be used 2 grams intravenously for 7 to 14 days. And in the same fashion, the amoxicillin plus clavinate orally for 14 days is another reasonable option. Now, prevention, how will prevent? Prevention is that the person should be hygienic and the urinating immediately after intercourse. That will not be confirmed to affect UTI frequency, including urinating immediately after intercourse. The type, this is a myth. The type of the underwear used, personal hygiene method used after urinating or defecating, or whether a person typically baths or showers. These are the points of the hygienic nature. It should be practiced. In the Islam, they are strictly what is called taharat. That is why we are free from these problems. There is similarly a lack of evidence surrounding the effect of the holding one's urine. So it is a myth that the holding of the urine can cause it. Tampon use and the doffing. Again, this is a myth. In those with frequent urinary tract infection who use spermicide or the diaphragm as a method of contraception, they are advised to use alternative methods because there is repeated urinary tract infection in those people. And those people who have got the benign prostatic hyperplasia, urinating in a sitting position appears to improve bladder emptying. Sitting position, not on the erect position, which might decrease urinary tract infection in this group. This is again another warning, because in Islam you have to urinate in the sitting position, not in the erect posture. Using the urinary catheter as little as short of time or possibly inappropriate care of the catheter when used prevent the catheter-associated urinary tract infections. So the catheter should be changed according to the recommendations. So this is how you can prevent it. Medication and prophylaxis, repeated infections, nitrofurantoin, the sulfamethoxazole, trimethoxazole combination, methenamine, again is an agent which is used as antiseptic, urinary antiseptic, formaldehyde. It can, because this is an agent used for the purpose of the bladder where the acidity is low. It produces the formaldehyde, this agent, to which the resistance does not develop inside the urinary bladder. That is the way of action of methenamine. You can use it in a selective patient of medication as a prophylactic therapy. Taking antibiotics, those people are related to intercourse. They said that after repeated intercourses or coitus, they developed infection. In those people, for example, in the postmenopausal women, topical vaginal estrogen has been found to reduce the recurrence. They use it so as a lubricant also. It will definitely cause the wet it is from the hypersecretion rather of secretion which are dimmed down of the vaginal glands. It is very helpful. Pessaries, vaginal estrogen from pessaries are used. The estrogen pessaries not usually practiced. A number of the vaccines are in the development since 2018. Children again, they have got a habit of, hygienic habit should be adopted in the children. Those people who are at the higher risk of developing, they should be given the prophylactic antibiotics. While in alternative medicine, the cranberry juice or capsule, this is another one which you can restrict the infection. However, the Cochrane review will not, satisfied with this. They have trialed of the cranberry juice. Probiotics require further studies. These are the other drugs which are developed for this. They are said that it is not very, very effective prophylactic. The role of the urinary microbiome is in maintaining urinary tract health is not well understood. 2015 is concerned. At 2022, one review found that taking mannose was an effective as antibiotic to prevent UTI, while another review found that the clinical quality was too low to allow any conclusion about using the D-mannose to prevent. We use D-mannose. It is converted out into it will alkaline the urine, rather acidify the urine inside, and possibly it will prevent it, the mannose. But it is under the trial. Not 100% you will say that is this. Cranberries contain a substance, you word cranberry is using nowadays very frequently. They prevent bacteria from the sticking on the walls of the bladder. They may help reduce bladder and other urinary infection. They said that they are preventing the bacteria from the sticking on the walls of the bladder. Now, this is the mode of action. The cranberry, usually a cranberry juice, have been used to try and treat UTIs, particularly in high-risk groups such as older people. The cranberries are not cultivated in these areas. The cranberries are in Europe and other countries. So the sachets are available. Cranberry sachet can be used. Tablets sachet can be used. Now this is how we manage the cases of urinary tract, how we diagnose, what is the diagnostic criteria, how will you do the diagnosis, make the diagnosis, perfect diagnosis. So inshallah, I hope that you can understand this summarized lecture, although I want to talk more on this, because of lack of time I can't do this. So, وَمَا عَلَيْنَا إِلَّا الْبَلَاغُ. Assalamu alaikum wa rahmatullahi wa barakatuh.